In the second part of our presentation on therapeutic applications of light, we'll be looking at how light medicine today uses light to heal our body and our mind. Now, I told you in part one that around the year 2000 there was a great acceleration on research on the therapeutic uses of light. And this was brought about in a large part by one very important pioneer in the field, Dr. Tina Karu from Russia. Dr. Karu worked in the 1980s and 90s to try to understand why light would act on our biology in such a powerful way, because there was no known mechanism that could explain that previously. And because there was no known mechanism, scientists could not take much interest in it. And what Dr. Tina Karu discovered after extensive and very patient research was the mechanism through which this worked. And she found out that it was primarily due to the action of light on cell mitochondria, which are small structures within each of our cells that act to create our primary fuel source, ATP. And what Dr. Karu deciphered after years of work is exactly how this comes to happen. There's a whole respiratory chain within the mitochondria that converts primary materials such as glucose into the energy, the ATP, used by our cells. And she found that at some key moments in that complex process, light can come into play and can stimulate some of these stages. And so she made clear how light could increase ATP formation and could have create a whole cascade of effects within cells, acting all the way to DNA repair and stimulating regeneration and so on. So once that was understood more clearly, the path was open to research, and now there are thousands of scientists working in this vastly expanding field. I had the pleasure to meet Dr. Karu when she came to our International Light Association conference in 2011, and she was right here on our property where I do research in Canada. Here you see her walking on the land. So very important name in the world of light medicine. Very beautiful person as well, very full of light. So the field that's been unleashed by her discoveries is what is called now low-level laser therapy, LLLT, and it's now used very widely in different parts of medicine. One of the most common use is to treat inflammations of joints and muscles and tendons. So you can use this light, either deep red or infrared, to treat arthritis, tendinitis, and so on. Sports medicine and healing, many applications. There's also many different types of applications of low-level laser therapy. Here I'm listing few recent clinical research articles that have come out about nerve regeneration, about treating herpes, treating thyroiditis, treating macular degeneration. So many areas where light is starting to be used as a healing source. It's also used for skin treatment. This is also becoming more and more spread in our society. It's been discovered and researched that different parts of the light spectrum, whether red, infrared, yellow, amber, blue colors, have all kinds of different effects that can help to heal scars and wrinkles and acne and so on. So it's also becoming more widely used. There's also recent research showing that it can stimulate hair regrowth, and this is leading to the creations of all kinds of gadgets that are starting to appear to generate light on the scalp, and you see a few of those instruments here. Here I'm showing an example of a quite striking application of light therapy, and this is from another colleague of our association, Dr. Alexander Wunsch in Germany. And this shows a treatment of a burn, a third-degree burn, solely with light, so no other treatment. And you can see that within 2 weeks of treatment, this deep burn, which would normally leave a lifelong scar, has been completely healed. And a photo taken a few years later, and the last one at the bottom of the page there, shows that there's no scars left at all. So very successful treatment of light with of burns with light. Another interesting application of light is through what's called transcranial therapy. I had the pleasure to meet one of the pioneers in the field, Dr. Michael Hamblin from Harvard Medical School, at another one of our conferences, and he showed us how light penetrates through the skull. There's a few percent of infrared light especially that will go through the skull and then reach the brain, and this can be used for many types of treatments. And Dr. Hamblin and his colleagues have been exploring different applications, such as treatment of head trauma, treatment of strokes, cerebral flow stimulation, and there's even indications that it could be helpful for things like Alzheimer. So very powerful use of light here to treat directly the brain. Also has cognitive applications, where this infrared light transcranial is starting to be used to treat chronic cognitive deficiencies, to help memory problems, and to help alleviate depression and anxiety issues. And some of the research is quite striking, where a single treatment of a few minutes shows clinically measurable effects. So a powerful effect of light on us here. Now, another very widely known field of light therapy is through the non-visual optic pathway. As we've seen in part one of the presentation, there's a direct link between the retina and the hypothalamus, whereas light can directly act on our circadian rhythm, our chronobiological clock. And in fact, this is so well known now that for many people this type of treatment is synonymous with luminotherapy. When people talk about luminotherapy, they usually refer to this treatment of chronobiological issues with light. For example, helping seasonal affective disorder and other depressions due to lack of strong light in deep winter in northern countries. And we now know that such bright light therapy can help in many different types of issues, sleep problems, cerebral aging, and so on. So this is the use of bright light to restore a lack of entrainment of our inner clock by the daily cycle. Another very interesting way in which light acts on us is through brainwave entrainment. And it was discovered, ever since we've discovered the existence of brainwaves as such, in the 1930s already, we started to work with these waves, detect these waves generated by the brain during its normal function. It was found out very early that not only does the brain create those brain waves, but if you expose the sensorial system to stimulus which is in the same frequency range as those brain waves, which is roughly between 2 and 20 hertz, then the brain has a natural tendency to fall in sync, in resonance with this external stimuli, whether it is from light or sound. And so it was found early on that pulsing light, stroboscopic light, can be used to entrain brainwave generation. This led to early explorations. For example, here you see Geisen's Dream Machine, which was a psychedelic device that was used in the 50s and 60s, it was one of the early examples of using this pulsing light to create altered states of awareness. And this led from the 1970s onwards to the creation of what's called now audiovisual entrainment devices. And these devices help to interact with our brainwaves through pulsing light. Now, of course, you probably heard of the different brainwave ranges, alpha waves, theta waves, beta waves, and they correspond, each frequency band corresponds to a specific mental state. And this is an area of medicine which is now quite well researched and validated. So you have a whole range of different gadgets now that use pulsing light to interact with those with brainwaves, and there's been a number of interesting clinical studies showing that you can use these in beneficial ways to help for things such as attention and learning deficit, affective disorders, insomnia, and post-traumatic stress syndrome, and so on.